you mentioned something really key, and you were talking about women and menopause. And I see so many women enter menopause, and we see a lot of issues. A lot of them will develop breast cancer, and they go through these really just difficult times. But what about menopause and osteoporosis? What's that connection, and what can women do to maybe offset that?
Great question. Menopause and for the 10 years after, as I mentioned, is the fastest rate of bone loss in women. And there are a couple reasons for that. One is estrogen is what's called anabolic. It helps to build bone. And which is why some of the FDA approved medications actually work on that estrogen pathways in bone to help continue to have the beneficial effects of estrogen. However, estrogen also is anti-inflammatory, and chronic inflammation damages bone, creates free radical damage. It damages collagen. Not only does free radical damage directly damage collagen, but it also prevents your cells from producing new collagen. And it damages collagen by creating what's called advanced glycosylated end products, or AGEs. And it makes collagen stiffer and more brittle. And why is that important for bone? Well, we are familiar with the minerals in bone because that's what a bone density test looks at. When you get a bone density test result, the only thing that it's evaluating are the minerals in bone. But bone is more than just minerals. It's a tissue. It's a complex tissue. So there's more elements in it than just bone. The other major element in bone is protein and collagen. Collagen, or type 1 collagen, 90% of collagen in the bone is type 1 collagen. And it's actually the collagen that gives bone its ultimate strength and quality. If you were to take all the collagen out of bone and the collagen were to degrade, all you had left was the minerals. It'd be brittle like a column of chalk. But when that collagen in there, and collagen is in all of our tissues in our body, it gives the flexibility to the skin when you pull it and it snaps back. That it when collagen is healthy and somebody falls, the impact hits the bone, and then the bone can deform a little bit. The collagen can absorb that and actually deform a little bit and not break. And so estrogen is one factor, the drop in estrogen, that can create damage to the collagen, as well as reducing minerals, because minerals actually bind to collagen as well. So you need healthy collagen for that. The other thing too, after menopause, it's not just the drop in estrogen, but as people get older, they're also more likely to take medications and more likely to take multiple medications and have what are called comorbidities. So they may have high blood pressure, they may have heart disease or diabetes. The more comorbidities people have, and the more severity, the more severe they are, well, two things happen. One, it increases their risks for osteoporosis, because a lot of these conditions are inflammatory conditions, chronic inflammatory conditions. But also, if somebody does break a bone, if they have comorbidities, the more severe the comorbidities are, the greater their risk from dying from that fracture.
Wow. Okay. What are your thoughts then on hormone replacement therapy, also known as HRT? There is a lot, I think, of misinformation in terms of, I think at least women have been taught by the Western model that estrogen is bad. More estrogen, that's what causes breast cancer. So what are your thoughts on if someone wants to use HRT? You're a naturopath, and you, I'm sure, like to do other things first before going to that. But I'm just curious, just in general, what's your thoughts on HRT for osteoporosis?
So my thought is that it can be beneficial in terms of helping to promote bone health, with a little bit of an explanation. I think it's important to understand a little bit of the nuances in this debate. So the adverse effects from hormone replacement was done on equine estrogens, estrogen literally from horses, which are different types of estrogen. So it's not bioidentical hormone replacement, which is what integrative doctors, naturopathic doctors, functional medicine doctors who practice in this way will prescribe. So what we would prescribe is bioidentical hormone replacement, literally identical to a woman's hormones. And the body can convert, there are different types of estrogen. It's a category of molecules. It's not just one thing. So there's E1, E2, E3. And so typically people will prescribe either, E2 that will be converted into the other forms, or a combination. And if somebody is at high risk, if they have a history of estrogen receptor positive breast cancer, that's something that would be a contraindication. You probably wouldn't want to do that. If there's a strong familial risk, you may want to proceed with caution. But that's part of an evaluation that's important to understand. Just like any medication, is it appropriate? Do the potential benefits outweigh the potential risks? And when you're looking at dosing, you're not talking about high doses. You're talking about doses just to get people back into the normal range, to maintain that normal range that they had before.